In this video, I'm going to show you how to relieve meniscus pain in 30 seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to focus on getting quick knee pain relief being caused by meniscus injuries. If you're unfamiliar with the meniscus, it's a thick C-shaped piece of cartilage that acts as a shock absorber in between your shin bone and your thigh bone. When this gets irritated, inflamed, and possibly torn, you can get a lot of symptoms, including localized knee pain, swelling, popping and pain while trying to bend and straighten the knee and then turning it in and out. To make this easy, I'm going to break this video up into two separate parts. In the first part, we're going to focus on getting quick knee pain relief by decompressing or taking pressure off of that meniscus. And you may find that this gives quick relief, even within 30 seconds. In the second part, we're going to focus on prevention and hopefully avoiding a possible surgery by strengthening the muscles and soft tissue that helps support that meniscus and the knee. All of these exercises work just a little bit differently. Make sure to go through them all and use what gives you the best results. As a bonus, all of the exercises can be done at home, require no special equipment, and again, you may find give quick knee pain relief even in as little as 30 seconds. So let's get started. The meniscus acts as a cushion and shock absorber for the knee. So one of the best ways to get quick pain relief is to decompress or take pressure off the knee through pulling motions known as traction. So I'm going to go over a couple different methods that are really going to help open up the knee, and you may find give quick relief even within 30 seconds. We just need a thick rolled up bath towel for this first one. So I'm just going to sit on my butt just like this. Whatever knee that you're having issues, you're just going to put that towel right behind it just like this. Slide your heel back towards you as much as you can. From there, I'm going to take my hands just like this, put them on my shin, and then try to drive my heel backward towards my butt as much as you can. What this will do is cause a wedge to form within the knee from this towel right here, and you'll feel a gentle pulling traction into the knee. Only go to your comfort level with this one. Make sure it is not causing any sharp pains or agonizing pains. If that's the case, back off just a little bit. But with this one, I try to hold it for about 30 seconds. From there, I just relax, take a breather, and then repeat this one up to 5 times. With each repetition, you should notice that you have a little bit more range of motion to traction in there just a little bit more. So how to take this one to the next level, what I'm going to do is experiment with different placements of my foot to help open up the knee just a little bit differently. So what I'm going to do with my foot this time around is take it outward as much as I can and then repeat this traction. So you'll notice again the knee just gets hit a little bit differently. What you're trying to do is experiment with different positions of this foot to open up the knee a little bit differently to find a spot or movement that offers you the most amount of relief. So experiment with going all the way out and then experiment with going in. If you find any certain spot that works better for you, at that point, throw more repetitions in. This next knee and meniscus decompression exercise is a little bit more advanced than the first one, so make sure that you're comfortable with that one first before moving on to this one. Again, I'm going to be using a large rolled up bath towel. We're going to go next to the edge of a bed. Take the knee that you're having an issue, place it up on the bed just like this. What I'd like to do is slide forward until my whole bottom part of my leg is supported, and I'm going to be able to hook my foot and toes into the edge of the bed for a little bit more of a stable anchor point. So I'm going to take my towel right here and I'm just going to wedge it right behind my knee as much as I can. From there, the movement is very easy. I like to take my hands, overlap them, put them onto the top part of my leg right here, right over the quadricep, but I'm not going to press into it. I'm just going to instead use my body weight to lower my butt down towards my heel. The more that you do this, the more that you're going to feel your knee start to open up with that gentle traction. Go to a point where it feels comfortable and deep, but not causing discomfort. Nice part is you can really use your body weight to slowly build into it. Once we hit that point, we're going to hold this one for an extended period of time. 30 seconds, a minute or two, whatever you feel comfortable with. But when you need a breather, just slowly come back up like this. On the next repetition, try to build into it even more to take more pressure off that knee and meniscus. I try to repeat this one for about 5 complete repetitions. One of my favorite ways to get knee and meniscus pain relief is through the banded traction method. Not only is it going to do all of the hard work for us, but it's going to hit pretty much everything in the leg at once, the ankle, knee, and the hip. I'm going to be using a pull-up band for this. They're very easy to get. You can get them at any sporting goods department, or you can get them online. If you would like to get them online, I will leave a link in this video's description. They're pretty inexpensive, and it is a worthwhile investment if you do have a lot of chronic knee pain. So with the pull-up band, I'm going to open up a door, place it over the doorknob on the other side just like this, loop it around the bottom of the door, and then close that door shut. So now we have a stable anchor point, and this won't come back to whack us. So let's begin by taking the ends of the pull-up band right here and then crisscrossing them over our ankle and foot. That way it's sturdy and it's not going to slip off. During this exercise too, you want to make sure that the band and your leg is in a nice straight line so you're not tilted. So I'm going to scoot back just a little bit and then I'm going to lie flat on my back. The side that you're focusing on, try to keep that knee as straight as possible. The other knee is going to go bent, foot is going to be flat. Use this bent knee side right here to slowly push yourself away from the door. The more that you go back, the more that you're going to feel that deep pulling traction motion in the leg. I usually feel it into my ankle, it works its way up to the knee, and then the hip, kind of like a domino effect. But we really want to focus on feeling it into the knee. Once we feel that, hold this position comfortably for 3 to 5 minutes. Grab a book, your phone, just take your mind off of it. If you do need a breather, you can scoot back just like this. But try to do this one for 3 to 5 minutes and break that up into as many repetitions as you would like. To take this one to the next level, what we can do is put the knee into different positions to find more relief. So I'm going to take my foot this time around and turn it all the way out as much as I can and then scoot back. You'll just notice the knee gets hit a little bit differently. So go all the way out. Experiment by going all the way in. You're going to notice that one certain position offers you the most amount of relief. At that point, you want to throw more repetitions in and hold that for longer. If your goal is long-lasting pain relief, prevention, and possibly avoiding a future knee surgery, your main focus needs to be on strengthening the muscles, tendons, and soft tissue that support that knee. I'm going to go over 3 different strengthening exercises that will be progressively more challenging. Start with the first one. Once you feel comfortable, move on to the second and then the third. I really like this first one because it's easy, but it's also going to help lengthen all of that soft tissue around the knee, engage the muscles, bring blood flow into the area to help promote healing, and take a lot of strain off that meniscus pretty quickly. So this one can be done in bed or on a floor. Whatever knee that you're focusing on, bend it and then put your heel into the floor or the bed, toe slightly up towards the ceiling. Bring that heel backward towards your butt as much as you can until you start to feel a deep stretch into the knee, not to the point of discomfort or pain. Go right before that point. From there, what I'm going to do is take my foot and then turn it outward as much as I can. Really start to feel those muscles fire around the knee. You really want to focus on feeling that. This is a nice isometric exercise. Once we feel that, we're going to hold this position for 5 seconds. We're then going to do the opposite and turn our foot inward as much as possible. You'll notice the muscles get hit just a little bit differently. From there, you can relax, take a breather. On this next repetition, scoot your heel towards your butt just a little bit more. You'll probably notice you have more flexibility now, and then you're just going to repeat this process. But I try to do this for about 5 complete times, and with each repetition, I'm trying to challenge myself to build into it just a little bit more. This next strengthening exercise is going to focus on more muscle groups that help support proper knee function, including the hip flexors in the front part of the legs, the hamstrings in the back, and also the glutes. This is known as a pelvic bridge, and it's very easy to do. Just start off lying flat on your back in bed or on a floor. My legs are roughly hip width apart, my knees bent, feet are flat. I'm going to take my hands, place them on my hips. Tighten your core muscles, and then from there what you're going to do is lift your hips and pelvis upward towards the ceiling until your body is in a nice straight line from your knees to your hips to your shoulders. If you're unable to get into this position, let's say you can only go up an inch or two, do the best you can. Over time you should gain strength and flexibility to be able to get into this position. But I feel a ton firing. My core muscles, lower back, the glutes, the hamstrings, the legs, all around the knee also. I try to hold this position comfortably for about 5 seconds. From there, you can relax, take a breather. You want to repeat this one 10 to 15 times. Build into these motions with each repetition. From there, you can make this more challenging by throwing in another set or two. But you can also experiment by just lifting one leg up just like this. Straighten your knee. It will put all of your body weight on the other side, including that knee. So if you feel like you can progress into this movement, do it. Hold for 5 seconds, relax, and then make sure to do it on the other side to keep both sides in balance. You can do other variations of the bridge too to hit muscles just a little bit differently. So if you would like to focus a little bit more on the glutes, let's do what is known as a clamshell. So I'm going to put my feet together, I'm going to take my knees right here and then wing them out as much as I can until I feel an activation in the inner part of the thigh right here and also into my hips. The movement is pretty much the same. From there, we're just going to lift up with our hips. This time around, I really feel it more into my glutes right here. But you can do that for 10 to 15 times for a couple sets. If you want to target more on the back of the leg into the hamstring, what you're going to do is get back into that original bridge position, but this time around, take your feet, put your toes upward towards the ceiling, drive your heels down into the bed or the floor, and then just walk out very slowly. You'll feel a ton fire in the back of the leg. So give that one a try. If you feel like any of those muscles feel just a little bit more weak or achy, it might be one of the reasons why you're having that knee pain, and you should focus on strengthening that. With this last strengthening exercise, we're going to put the knee through dynamic movements. That's through different positions to get better results. This is known as star taps. For this one, we need something that is going to glide on the floor. So if you have carpeted floors, you can use something like a piece of cardboard, a paper plate, or in my case, I'm going to be using a furniture mover. If you have smooth floors, you can use a towel or thick socks. So let's start standing with very good upright posture. Tighten your core muscles during this exercise for a little bit more support and stability, and put all of your body weight onto your heels. Whatever side that you're having pain, you're going to put all the body weight onto the painful side. I'm going to show two different variations of the star taps also. The first one's a little bit easier to do, so once you feel comfortable, then progress into the second one. So with the first one, all my body weight goes onto my bad side's knee right here, and then I'm going to slowly squat downward until I feel a very deep activation of the muscles around the knee, into the hamstring, and also the glute. Do not go to the point of severe pain. Go right before that. We're going to help build into that. So the other leg, what I'm going to do is put the glider underneath the non-painful side's foot. This non-painful side for the first part will do all of the work for us. So once we're in position, we've squatted down, we feel the muscles activate, I'm going to then take this leg right here, the non-painful side, and then just glide forward with the foot. You'll notice that this challenges the knee and the body to stabilize this movement. Hold this comfortably for about 2 to 3 seconds. From there, you're just going to come back and relax. So again, we're going to keep our knee locked right here, and this time around, we're going to just go out just off to the side with this next repetition. It hits the knee just a little bit differently. You may find too that during this movement, your knee will want to buckle in or out. You really have to focus on trying to keep that knee straight to build stability. So you're going to do a complete arc, going from the front all the way off to the side, and then all the way towards the back. And once you get all the way towards the back, what you're going to do is then work your way back forward. You want to do this 2 to 3 complete sets. You may find too that one certain angle, like let's say right here for me, just hits it a little bit better. Make note of that. Throw more repetitions in any spot that you feel just challenges the muscles a little bit more or offers you more relief. Also, with each repetition, you may find that you have a little bit more flexibility. So after you do that whole cycle, squat down just a little bit further and then repeat. It will just help strengthen those muscles a little bit more. So this is how we're going to take it to the next level. What we're going to do this time around is a similar movement, but the painful side's knee now is going to do all of the work for us. So this time around, I'm going to squat into the movement and then glide my foot out. So what I'm going to do again, tighten my core, put all my body weight onto my heels, and then just squat down and then bring that foot forward or out as much as you can. Squat down as much as you can, not to the point of pain. Hold this for a couple seconds, come back up, and then you're just going to repeat this whole process. Again, if you find that one certain spot, like let's say right here for me, is the most challenging, you want to throw more repetitions in. And with each repetition, you want to focus on trying to squat down even more because it will challenge those muscles and build more strength over time. If the exercises helped, please support this channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.